timely identification of device-related malfunctions, and ultimately contribute to better patient engagement and improved health outcomes. Knowledge is power, and a patient privy to these data is an empowered partner in his own health and healthcare. Access to my device's data can help me track, understand, and manage my condition better, become more active in my care, and work more effectively with my providers. I rely on the FDA to protect me, and I need the FDA to stand with me in this quest for openness, access, and transparency. In the spirit of the new rules proposed last week by Health and Human Services Secretary Kathleen Sebelius that strengthens patients' rights to access their own laboratory test results directly from labs, I would like to ask the FDA to follow suit and publicly declare that patients also have the right to the raw data collected and stored by the manufacturers of their implantable devices. I have the right and the responsibility to care for myself, but cannot do so without information. It is time to fix this and put patients and our families at the center of our own care, and I call on the FDA to help us get there. Thank you. And so that's the message I delivered.
Great. Okay. And to close out this section of today, before we get to our questions for ONC, I'll call somebody from ONC up here named Lydia Ricciardi to talk for a few minutes about ONC and patient engagement and whatever else Lydia wants to talk about for a few minutes.
Okay.
Thanks.
So I'm really excited to hear your questions, but before we hear your questions, perhaps we should tell you a little bit about what we're actually up to, and maybe ask you a couple